My name is Khalid Sharif, and today I'm going to talk about partial thickness rotator cuff tears. This is an educational video and it's not meant to guide you to diagnose yourself or indeed to treat yourself for this condition. Now, partial thickness rotator cuff tears are a common condition. We're going to talk about why they happen, how they present, what happens to them if left alone, and how do we treat them. So, how common are partial thickness or indeed full thickness rotator cuff tears? There have been an MRI study looking at asymptomatic patients, and they found that 35% of these had some sort of rotator cuff tear. 20% of these were, or 20% were partial thickness tears, and 15 were full thickness tears. Having said that, the incidence with age changes. So that study was done on adults patients. So if you look at adults below 40 years of age, only 4% had some sort of rotator cuff tear, whereas those over 70 years of age, 80% had a rotator cuff tear. The types of rotator cuff tears are three, and this is a schematic presentation. So this is the supraspinatus muscle. It's attached to the greater tuberosity of the humerus, and it's the muscle that lifts the shoulder up, and this is its tendon. Where the fraying of the tendon happens on the upper side, this is called the bursal type partial thickness rotator cuff tear, and this is the less common, whereas the more common type, which is a fraying on the undersurface of the tendon, which sometimes is called as a pasta lesion. The third type, which is the most common, is about 55%, is the intratendinous type of partial thickness rotator cuff tear. And in the intratendinous type, when you look arthroscopically from here or from the top, you don't see a rotator cuff tear because both surfaces would be intact, and the tendon has given way, or the tendon fibers have given way inside the tendon itself. The superior, these bursal types, which are more common than the, these articular type rotator cuff tears are more common than the bursal types. This one. The articular surface ones happens in the overhead athletes. The bursal types happen in the elderly folks, part of impingement of the shoulder and rotator cuff disease. Now, why do they happen? There are a multitude of factors, both intrinsic and extrinsic. The intrinsic factors are certainly age and poor blood supply to the tendon. The extrinsic factors include impingement, both internal and external, instability in the shoulder, and overhead activity, as in overhead athletes. Now, what happens to these tendons? Let's talk about how they present first of all. They present with pain in the shoulder, pain with overhead activity, pain at night, and weakness in the shoulder. Examination, you've got to examine the rotator cuff, and there are many signs and weights to examine, and that's beyond the scope of this video. You diagnose it both clinically and with a scan. And this is very important because just finding a cuff tear on the scan does not mean that this is the cause of the patient's symptoms, or indeed that you need to operate on this patient to repair that cuff. You need to correlate the scan result with the clinical presentation. And the scans can be either an MRI or an ultrasound scan, and they're both as effective, both sensitivity and specificity, in diagnosing partial thickness rotator cuff tears. Although some prefer the MRI because it's less operator dependent. Now, how do we, what happens to the rotator, what happens to them if you leave them alone? If left alone, 75% stay as they are. They do not progress. 16% progress, and 8% change, progress as far as changing to a full thickness rotator cuff tear. Having said that, the likelihood of it progressing depends on the thickness of fraying of the cuff tear. So if it is more than 50% of the thickness of the cuff that's been involved, of the tendon has been involved, then 55% progress. If it's less than 50%, they found that only 14% progress. So it's the more severely involved ones that progress. The less severe ones tend to stay as they are. Do they heal? No. Partial thickness rotator cuff tears do not heal. They either stay as they are and the patient copes, or they progress and become a full thickness tear and the patient becomes symptomatic. How do we treat partial thickness rotator cuff tears? The mainstay of treatment is with physiotherapy, non-steroidal anti-inflammatories, painkillers, activity modification, basically trying to improve the power of the rotator cuff. And that will work in the majority of cases, the early presentation of this condition. The surgical treatment is twofold. One is either a debridement of the tendon with or without subacromial decompression. So with the debridement, we remove the loose tissue around the partially torn tendon. And that is very effective in removing the pain from the partial thickness tear. We do this with or without shaving of the hood of the shoulder, the acromion, a procedure we call arthroscopic subacromial decompression. Does that affect the healing of the tendon? No. It does not have anything to do with improving the healing of the tendon, but it's very effective in reducing, dealing with the symptoms. Now, the other treatment is repair of the rotator cuff, and that could be either aimed at the fibers that have given way, or changing the partially torn tendon to a full thickness tear, and then attaching it to the greater tuberosity with single row or double row anchors. Does that work with overhead athletes, young patients with partial thickness tear? Yes, it is effective when the conservative treatment has failed, but research has shown that less than 50% return to their full shoulder function. So in summary, partial thickness rotator cuff tears are a common condition, a common cause of shoulder pain, and their presentation increases with age. Their causes are a multitude. They're internal and external factors, or intrinsic and extrinsic factors of the tendon. And the treatment is mainly non-surgical in the form of physiotherapy, non-steroidal anti-inflammatories, strengthening exercises for the rotator cuff, but the surgical treatment is in the form of debridement with or without arthroscopic subacromial decompression and repair of the rotator cuff. Thank you.